Go.
Hi, my name is Kent Kinslow, and I'm going to be performing a diabetic foot exam today on Jeremy here. Tools required for this exam: tuning fork, reflex hammer, monofilament, and Q-tips. Okay, first thing here, just going to be looking at any abnormalities or digital deformities on Mr. Urban's feet. Looking for any hammer toe, obvious calluses or ulcers here. Don't see anything. Also going to be checking the flexibility of his feet. Can he bend these feet past 90 degrees? Mr. Urban can. That would be noting for any equinus if his foot was stiff. It did not bend. Be an abnormality we would need to have further assessed. We're going to be checking the muscle tone in his feet. Press back against my foot here, Jeremy. And here. And push against my feet. Strong, equally, bilaterally, that's good. We're going to also be looking at the metatarsals. Seeing if there's any plantar flex metatarsals there, which could lead to ulcer formation if there's anything protruding out past the soles of his feet. Also, we're going to be noting the general contour of the soles of his feet. Looking for any Charcot or it's like a rocker bottom. His foot would be shaped like this, which is obviously abnormal. Shape of his feet looks good. We're also going to be looking at any dampness between his toes for any athlete's foot, tinea pedis, which all looks normal there. Dry feet, that's good. The skin, we're going to be looking for any, like I said, calluses, dry skin, cracking, xerosis as it's called, medical term, and Jeremy actually has pretty good feet, I'm shocked. Also, we're going to be looking, like I said, ulcers, which would be an obvious thing, which Jeremy does not have any ulcers. We're also going to be looking at the toenails, see if there's any ingrown toes, the thickness of his toenails, which ingrown toenails are a precursor to ulcers for diabetics. We're going to check the temperature of his feet, and which is a circulatory issue. If they're unequal, temperature feels good on both of his feet. We're going to check the pulses, the dorsalis pedis pulse on both feet, equally strong, and the posterior tibial, also equally strong. Like I said, that's the temperature and the pulses, checking the circulation on Jeremy's feet. If that is uneven, a good test for that would be an ankle brachial index, just to look at the circulation of his lower extremities. Also, we're going to be looking for any varicose veins or swelling or edema in his feet, and Jeremy has none of that, so that is also normal findings. Next, after we just do our initial just looking at his feet, we're going to start with our monofilament testing, which there are a few certain areas we're going to look at here. And Jeremy, I'm just going to ask you to tell me if you can feel this. And the way you want to do this is you want to press the monofilament against Jeremy's feet until it bends. Did you feel that?
Yes.
Okay.
Yes.
On each of his toes?
Yes.
On each of the third metatarsals first,
Yes.
third, last, and heel, until it bends. And if Jeremy couldn't feel that, this is the most sensitive test that we're going to do on a diabetic's foot. If he couldn't feel that, that would obviously be an abnormal finding and could be leading to neuropathy, which, you know, if he can't feel this, he's obviously not going to be able to feel a rock in his shoe. So that's the most sensitive one. Next, we're going to go to the tuning fork, which tests vibration sensations. I'm just going to ask Jeremy to tell me how long he can feel this. And if he can't feel this in his foot as long as I can in my hand, then there's obviously a deficit there. I can still feel it.
No.
Okay. So Jeremy felt the vibration in his foot just as long as I did, if not more than I did in my hand. So he has no deficits there, no neuropathy in his feet, with tests of the monofilament or the tuning fork. Next, we're going to move to our sharp versus the dull sensation. Jeremy, this is going to be the dull sensation, obviously, and this is the sharp, okay? And I'm just going to ask you to tell me what you feel on the bottom of your feet here.
Dull.
Okay.
Sharp. Sharp. Dull.
So Jeremy was obviously able to distinguish between the sharp versus the dull. All his tests have been normal. We're also going to check the reflexes with the reflex hammer, and we're just going to tap the Achilles tendon here, and I can feel his foot doing like this, so he got good reflexes bilaterally. That was a really good one there. Okay, so all of Jeremy's findings have been normal. Now, since he is a diabetic, I would refer someone who has normal findings of their foot exam to have an annual checkup at least. And if there was some kind of abnormal findings, we would tell him, Jeremy, it could be as often as every 2 months that you might need to come in and have your feet checked. Finally, when we're getting him dressed, we're going to put his socks, make his shoes fit. Make sure his shoes aren't too loose, aren't too tight. Even though he did not have any neurological deficits in his feet, we still want to make sure he's wearing properly fitting shoes. And we're going to teach Jeremy that every time he's putting on his shoes, stick your hand in there, make sure there's nothing in there, rocks, spiders, tarantulas, whatever might be in there. And that he should self-exam regularly, which could mean every day get in the shower. If he's not an obese patient, you can bend down, look at your feet. Do that regularly. There's no reason you shouldn't do that. Daily is best, and as often as possible. So, thank you, Jeremy, for your participation, and thank you, Dr. Alexander, for this opportunity.